Righto, I thought we'd have a little chat about that thing that we're not allowed to mention, because mentioning it by name gets you kicked off the internet and the social platforms. But we certainly hear enough about it in the press all day, every day. The pressure's been put on us by governments and their media lackeys to receive a certain medical intervention, we'll call it, on penalty of losing our jobs, our access to public life, our ability to travel, and so forth. They're talking about bringing in passports and certificates to enable us to shop, to travel, etc. Using all kinds of bullying, coercion, and threats and intimidation, which violates all kinds of medical ethics, all kinds of legal principles, dare I say the Nuremberg codes, but let's not even go there. But fundamentally it violates the principle of informed consent. So yeah, the government actually have something to say about informed consent on their website, which is that informed consent is a person's decision given voluntarily to agree to a healthcare treatment, procedure or other intervention that is made following the provision of accurate and relevant information about the healthcare intervention and alternative options available. So yeah, we haven't actually heard a lot about alternative options. In fact, alternative options have been pretty much, they are also things that we're not allowed to mention. Safe and effective, off-the-shelf drugs which can be used off-label to treat the other thing that we're not allowed to specifically talk about, have been swept under the carpet. With adequate knowledge and understanding of the benefits and material risks of the proposed intervention relevant to the person who would be having the treatment, procedure or other intervention. So we can see there that that's pretty broad, and that explains that people need to actually be given the facts rather than told constantly from these bleating politicians and health bureaucrats that these medical interventions are safe and effective. How safe? Well, I've got here a fact sheet from one of the interventions, the A.Z. intervention, which has this to say. Actually, it doesn't have a lot to say at all. Duration of protection. The duration of protection has not yet been established. Studies are ongoing. Use in the elderly. There are currently limited data available for the efficacy and safety in individuals over 65 years of age. Further information will be collected from ongoing clinical studies and post-market monitoring. The decision to an elderly patient should be decided on a case-by-case basis with consideration of age, comorbidities, their environment, potential benefits and potential risks. Use in individuals with significant comorbidities. There are currently limited data available. Are we seeing a pattern yet? For the efficacy and safety in individuals with significant comorbidities. The decision to an individual should be made on the basis of potential benefits over risks to that individual. Pediatric use. The safety and efficacy of A.Z in children and adolescents aged under 18 years old have not yet been established. No data are available. Are we seeing a pattern yet? The reason why there is no data available is that these medical interventions are actually still in phase 3 clinical trials, at least until early 2023. So, we have no long-term, mid to long-term safety data. We have no data on their efficacy. So what gives? When considering a medical intervention, I think it's fair to ask, is it safe? Is it effective? Is it necessary? And do I have a choice? Apparently it's a hard no to all of these. Is it effective? Are they? Well, what we're seeing in countries which have reached their targets for uptake of the intervention, the 70 to 80% targets, are large numbers of breakthrough cases. So we're finding that there are just as many or more people sick with the illness and hospitalised and indeed dying from it that have received the intervention as those who haven't. And the response to this has been a push for more interventions, more, well, what can we call them? Injections. Israel has one of the world's highest daily infection rates despite high uptake. So, yeah. Are they effective? Are they safe? Are they necessary? Do we have a choice? Beats me. What do you think? Let me know.